Hi, I am Courtney Murphy, and I am presenting my Education Innovation Project, Awake Self-Prone Positioning. I came up with this topic after brainstorming probably for the last year. Um, I was looking for something that was innovative, something that was appropriate and useful to the students that I would be working with. And I also wanted it to be interesting, hopefully for the students and for myself, and something that was meaningful. I was researching, looking on the internet, asking questions, asking around, always looking and searching for something, and uh, never really opened my eyes to what was right in front of me, and that was the change in my reality as a nurse over the last year, working in a COVID ICU. So one day there it was right in front of me, and I thought that was it. Um, I work in one of the largest hospitals in Western North Carolina, and last year my unit was converted to the COVID ICU. And over this last year, I probably have taken care of the sickest patients that have COVID-19 in my area. The care is mostly supportive, as there is not a targeted therapy for COVID-19 as of yet. Fairly disappointing and discouraging to take care of the sickest people in the ICU. Prone positioning is one intervention that was adopted from ARDS care, and in which the paralyzed, intubated, and sedated patients are prone, and that has been found to be beneficial. Based on the encouraging findings in that group, nurses have been encouraging their intubated COVID-19 patients to prone. This intervention is based on word of mouth, small and observational studies, and I feel is an example of clinical reasoning of the practitioners coming up with a solution in stressful circumstances. These small observational studies that I found are continuing to pop up. Even there's more now than when I started looking into this, but these practitioners are seeking to document their findings. What they are finding is that it is beneficial in the non-intubated COVID patients, and while it is beneficial, it is not yet proven to be so. So in assessing the need for this innovation, I reached out to my coworkers that are in the non-ICUs and the nurses and the respiratory therapists. I also spoke with two of the clinical educators in my hospital, and then I made some phone calls to 3 other hospitals in the areas, speaking to their clinical educators, all with the question that are you proning your non-intubated patients? Is it working? Are you following any protocols? Do you think education and guidelines on this topic would be beneficial? And the answer across the board was yes. They have been proning their patients. They would appreciate some guidance, and they are not following any kind of guidelines to say who they are proning, why they are doing it, how long, contraindications and such like that. I went and created a survey and sent it to the students that I will be working with, asking them if they knew what prone positioning was, if they knew any of the physiological changes that happen when you turn over to your stomach, and would they appreciate getting education on this? And vast majority, they knew what prone position was. They didn't know what the changes that happened, and they would appreciate this topic to be taught to them. I also looked over their curriculum as far as their what they learned about positioning and what they learned about pulmonary pathophysiology and anatomy. The how the class is going to go about is that my plan is going to be to start with an introduction of myself and a little bit about this innovation education program that they're participating in. I'm going to have a PowerPoint, and along with the PowerPoint, I'm going to lecture, and that's going to give a foundation of knowledge on what is prone positioning and what happens in the body when you do prone position. I also want to talk about some patient characteristics of why you should, why you shouldn't, who should you prone position on, and why would you stop, and indications, contraindications. I am going to show an informational video that will sort of tie it all together, and go over a case study of adapted from a real patient, and encourage questions and answer the questions and see where that takes us to a small extent. After that, we're going to do a hands-on portion of the class where there'll be role playing. I'm going to first demonstrate with my preceptor prone positioning of the patient, what the patient does and what the nurse will do, and then allow the students to alternate with those roles. We're going to have hospital beds in there with the various equipment that I think would most likely be in use with a patient that is not in the ICU but does have COVID ICU respiratory complications. My students are from a local university. They're enrolled in the accelerated nursing program. They are in the second semester of the first year of the 2-year program. They all come in with a bachelor's, and they're the prerequisites that this institution requires of them. The theory that I felt most aligned with the students and the topic was Malcolm Knowles' androgyny theory. He emphasized that adults are self-directed and expect to take responsibility for their decisions. Adults like to learn experientially, like they base it on their prior experience. They like to learn about topics that have immediate value, and they approach learning as problem solving. I did believe that these assumptions will very well align with the learners and the topics that I will be teaching. The intended outcome of this program is I would like to leave the students with a knowledge foundation about prone positioning that will facilitate their ability to deliver this care to their patient population when they graduate. The assessments that I will be using are a quiz to assess the understanding of the content, a checkoff skill sheet to assess their ability to assist their pretend patient to prone, and an anonymous post-class evaluation to assess myself and assess the content of the program, and to give them a chance to offer any suggestions for improvements. And that concludes my oral presentation of self-prone positioning. Thank you very much.